Hello, this presentation is for Dr. Alemiat's HAP 360 at George Mason University, and today we'll be talking about plan process improvement through EHR. So for this assessment, the objectives will be to analyze the data required to manage a depressed patient based on their genetic information, determine information needed for first and second visits, as well as the first call and the gap between the first and second visit. Determine the course of action based on the information gathered, and determine follow-up steps for working treatment. So we have to make several assumptions before we can begin, and that's that the patient has already had a primary care physician, along with a HMO staff model that the physician follows. The patient is aware of symptoms of depression, but not quite sure what's going on. The pharmacy is assigned to the patient already. Both parties have access to the internet, email, and phone, and patient has health insurance. And the last one, initial treatment is ineffective, and we'll see what we mean by that here in a second. So information required on first call, and this is just pretty much to make an appointment with our physician at first, and that's just the name and the phone number, date of birth, reason for visit, and availability. The first two are just to identify who the patient is. Third is to know why, and fourth is to get a consensus on time. So the first visit, patient information such as home address and email, if this is a first visit before, patient vitals, weight, and medical history including allergies. These three things, as well as symptoms, help to set a baseline of the patient in case that we need to give the patient any medication, so in case we need to know what changes. So this helps establish a baseline. And we also need insurance information, or if it changes in that case. So continued with the first patient, the physician evaluates the patient, listening to the patient describe his symptoms, and based on his evaluation, he decides that he's going to prescribe him some conventional antidepressants. The medication is ordered electronically through the system and is sent directly to the pharmacy to be filled, where the patient can go and pick it up. Physician recommends treatment for 8 weeks on this conventional antidepressant, and then after 8 weeks a follow-up visit. So there's some information we're going to require between the first and second visit, and that's going to be gathered on the second visit, and that's pretty much changes in symptoms, changes in weight, general mood, and behavior of patient. And pretty much along with those things, we can tell from there if the medication was ineffective or effective. In our case, we're going to say it's ineffective. So at this point, the physician refers the patient to a psychiatrist. So to our first visit to a psychiatrist, the psychiatrist evaluates the patient's symptoms and previous statement with the physician, and pretty much we decide to take a conservative approach by only doing talk therapy, as well as a DNA analysis, which the psychiatrist already has a kit of in hand. So, really quick, does a cheek swab analysis, and it usually takes 3 to 5 days to process the DNA testing. So, in this week time, a talk therapy is enough, and the psychiatrist does not order any antidepressants. And as well, a follow-up visit in a week is scheduled to go over the results. So the results are in, and we take a look, and from our findings, the psychiatrist looks at the assessments and notices the patient is a poor responder to the several different SSRIs, which are pretty much the common antidepressants you see that are usually first prescribed by primary physicians. So the patient isn't prescribed to a different class of antidepressants, where he might and most likely will respond better. And so then, the patient is told to follow up monthly twice. That way we can see his progress. Patient has reported less side effects from the previous antidepressant, as well as better overall mood and happiness. So based on our genetic testing, pretty much, we were able to give a more personalized, effective treatment to the patient, and that's what ultimately helps bring down overall visits and increases the quality of the whole process. So that is how essentially we help improve the plan process of EHR. So thank you for listening to my presentation, and that will be all. Thank you.